In the following video, we will demonstrate how an arthrodesis is performed on the tarso-metatarsal joints 2 and 3 using the shark screw allograft. The surgery is performed on the left foot of a 77-year-old patient. The X-ray shows the severe wear of the tarso-metatarsal joints. A dorsal skin incision is made between the metatarsalia 2 and 3. We now have access to both TMT joints. The extender tendons and vessel nerve bundles are protected with retractors. The joint capsule of the TMT joints 2 and 3 is opened. The joint space is spread, and one can clearly see the joint surface. A sharp spoon is used to carefully remove any cartilage leftovers. Afterwards, the bone surfaces of the sclerotic subchondral bone are roughed with a 1.5 millimeter drill. As soon as the bone surfaces are adjusted to each other under pressure from distal, a 1.2 millimeter K-wire is inserted from distal dorsal through the basis of the os metatarsal 2 to the os cuneiform intermedium. Following a second K-wire through the basis of the os metatarsal 3 to the os cuneiform lateral. Lastly, a safety wire is inserted into one of the joints for temporal fixation. This should avoid any movement of the joint surfacing during the following bone grafting. The positions of the K-wires are then checked on the X-ray machine. The size of the bone determines which shark screw to use. It is important that after drilling and tapping, enough cortical bone will remain as bone bridge for solid fixation. In this case, the black-labeled 5.0 millimeter shark screw is utilized. The black-labeled drill bit is used to drill the core hole over the K-wire. The depth of the drill hole can be determined using the laser marking. Next, the drill bit is removed and the nut thread is cut with a black tap. Again, the depth of the drill hole can be confirmed using the laser marking. If one cannot clearly determine which size of the screw to use, it is advisable to drill gradually from the smallest to the greatest possible diameter. It is important to rinse the canal with saline solution to remove any fine bone shavings that are produced during tapping. The shark screw is screwed in with the screwdriver without much resistance. After checking the position of the shark screw on the X-ray, any excess material is sawed off to the bone level, and the surface is smoothed with the bone mill. The shark screw now acts as a bone bridge and lead substance for the patient's own cells. It is recommended that the patient rest the foot for 3 to 4 weeks. A hallux valgus shoe is then worn for another 3 weeks. Shark screw allografts are made of cortical donor bone. It can be easily seen on the X-ray postoperatively. The allograft gets integrated during the bone remodeling process. Therefore, it cannot be seen on the X-ray about 1 year after grafting.